Namaskar, I'm Shubhendu Ghosh. You're watching Tracking COVID-19. All the updates on the virus outbreak from India and the world in the next half an hour. Prime Minister Narendra Modi, in fact, shared a post on life in the era of COVID-19. He says these days home is the new office and internet is the new meeting room. It's an important day for India tomorrow, as after 26 days of stringent lockdown, there will be limited relaxation in some sectors of economy. It is expected to benefit the rural sector and daily wage laborers in particular. Meanwhile, focus would continue to be on delivery of essential services. In the show up ahead, we will also take stock of how other nations are dealing with the outbreak and the best practices that have emerged. All that and more. Let's begin with the top stories. Prime Minister Narendra Modi says COVID-19 does not see race, religion, colour, caste, creed, language or borders before striking. In a post, Prime Minister Modi calls for collective response to fight coronavirus. More than 36,000 crore rupees transferred by using direct benefit transfer in the bank accounts of over 16 crore beneficiaries during COVID-19 lockdown. Cash benefits announced under Prime Minister Garib Kalyan package also being transferred. Union Home Ministry issues fresh advisory on migrant labourers. No interstate travel of migrant workers as of now. Stranded labourers in different parts of the country to be allowed to go to their respective places of work within the state with certain conditions. Ask states to carry out skill mapping to find out the suitability of various kinds of works. Some relaxation will be given from Monday. Some work will be allowed in places with no coronavirus case. State governments begin issuing guidelines. Delhi government says no concession will be given in Delhi due to high infection of corona. Home Ministry prohibits supply of non-essential goods by e-commerce companies during the lockdown. Says only essential items will be allowed to deliver. Over 3,86,000 tests for coronavirus conducted so far across the country. More than 37,000 tests done on Saturday. Total active COVID-19 cases in India stands at 13,295. COVID-19 cases continue to spiral globally with more than 23 lakh cases. More than 1.6 lakh people have succumbed to the disease. Total number of deaths in the United States nears 39,000. Now, as the nationwide lockdown continues, workplaces are shut. Millions of Indians are in their homes, many working from home. Prime Minister Narendra Modi reached out to these people and shared his experiences, saying that he's also working from home. Prime Minister wrote a post titled "Life in the Era of COVID-19." Let's take a look at 5 points that particularly stand out in his post. We'll be looking at them one by one. PM says home is the new office, internet new meeting room. Prime Minister says he himself is conducting work like that, meeting heads of state and other state chief ministers online. Also, he says phone call to connect with society. He's making phone calls to find out about well-wishers and how things are. Workplace becoming digital first. He says, why not? Poor people, he says he's been able to reach out to them through direct benefit transfer. All that became possible through digital transactions. New business models with particular characteristics is what Prime Minister speaks about, including efficiency and universalism. There'll be no scope for any sort of discrimination anymore. Most importantly, Prime Minister says we are in this together for the first time in time. The world is not fighting against each other. Different societies, nations are not against each other. We are facing a common enemy. Therefore, it must teach us the most core principle of standing together, also in different issues and challenges that come forth. That's a long post that Prime Minister had written. Some of the highlights were as we discussed. Moving on, the Ministry of Home Affairs has issued an order regarding the movement of migrant labourers stranded in different states of the country due to nationwide lockdown. The notification stated that no movement will be allowed outside of any state or union territory. However, they will be allowed to go to their respective places of work within a state with certain conditions. Since additional activities outside the containment zones have been permitted in the consolidated revised guidelines with effect from April 20th, the workers could be engaged in industrial, manufacturing, construction, farming and Manrega works. The order stated that migrant laborers residing in relief camps in states and union territories should be registered with concerned local authorities, and their skill mapping shall be carried out to find out their suitability for various kinds of work. If a group of migrant workers wish to return to their places of work within the state, not outside, they are currently in, they would be screened, and those who are asymptomatic would be transported to their respective places of work. No movement of labor outside of any state or union territory from where they are currently located will be allowed. It also should be ensured that social distancing norms are followed during the journey, and of course the mode of transportation, bus and others, is sanitized as per the guidelines of the health authorities. The local authorities shall also provide for food, water and other essential needs for the duration of the journey. National Directive for COVID-19 Management issued under Consolidated Revised Guidelines dated 15th April shall be strictly followed. And in a move to curb movement during the nationwide lockdown, Home Ministry announced that supply of non-essential goods by e-commerce companies will still remain prohibited as long as the lockdown prevails. However, e-commerce companies supplying essential goods have been exempted from lockdown restrictions. So, essential goods supply is the focus. Now, as per the latest Health Ministry data, there are some 13,295 active COVID-19 cases in the country. 519 people have died due to the virus infection in India. ICMR said that over 3,86,000 tests have been conducted so far across the country, and more than 37,000 tests were done on Saturday, yesterday alone.
कल के दिन में 37,173 यानी 37,173 टेस्ट हुए। उन टेस्टों में से 29,287 टेस्ट, अब ये लैब की संख्या हर रोज़ तो बढ़ते जा रही है। 194 लैब्स ICMR नेटवर्क में हैं, उनमें हुए 7,886 ये प्राइवेट सेक्टर में कल काफ़ी ज़्यादा टेस्टिंग में इम्प्रूवमेंट हुआ है।
Let's look at some state updates. The government of Maharashtra has announced that industries in green zones and orange coronavirus zones will get permission to resume operations in a restricted manner. Chief Minister Uddhav Thackeray, in a video message, in order to resume operations, industries, he said, will have to provide accommodation to their workers. The green zones are those which have not reported any coronavirus cases. Orange zones are the ones where only a few cases have been reported. Red zones are the ones where cases are on a rise. Chief Minister also said that except for movement of essential services, all the district borders should remain sealed. Maharashtra has entered 6th week in its fight against COVID-19. So far, 65,800 people have been tested, of which 95% people have come out negative. They're safe. The government has urged people to see the doctors if they have symptoms of cough, cold or fever. The government has also asked people to strictly stay away from self-medication. In such a scenario, the state reported the highest number of coronavirus cases at 3,651 with 211 deaths so far. After Maharashtra, Tamil Nadu government has said that all restrictions will remain in place during the coronavirus lockdown in the state. It will continue until official announcement is made by the Chief Minister. The government also said any relaxation of the lockdown will be based on recommendations of a 21-member expert committee set up for this purpose. The panel is scheduled to submit the report to the Chief Minister on Monday. The release also cited that centre's guidelines issued on April 15th that said that state governments would announce which industries, commercial establishments and services would be allowed to conditionally function after April 20th. And let's talk about the national capital. Delhi Health Minister Satyendra Jain said that first round of tests of all cases of Nizamuddin congregation has been completed. There hasn't been a single case since the last 4 days. Meanwhile, Delhi government has decided that in order to ensure security of citizens, there will be no relaxation in the national capital when the lockdown is on in the state.
दिल्ली के अंदर 1893 टोटल केस हैं, जिसमें से कल 186 पॉजिटिव केस आए हैं टोटल केसेस है। देखिएगा, स्पेशल ऑपरेशन जो निजामुद्दीन मरकज़ में चलाया गया था, उसके सभी लोगों का एक राउंड हो गया है टेस्ट का। तो पिछले 4 दिन से एक भी केस नहीं आया, तो अननेसेसरी रखने का इसलिए फायदा नहीं था, क्योंकि कंप्लीट हो गया है, उनके टेस्टिंग कंप्लीट हो चुकी है, इसलिए हटा दिया गया। रैपिड टेस्ट हमारे पास 42,000 किट आ चुकी हैं, 42,000, और वो टेस्ट के लिए आज उसका ट्रायल रन LNJP हॉस्पिटल में करा जा रहा है, साथ ही साथ ट्रेनिंग भी करी जा रही है। कल से इसको पूरी दिल्ली के अंदर जितने भी हॉटस्पॉट्स हैं सभी में किया जाएगा। कम्युनिटी स्प्रेड के बारे में एग्जैक्टली कि कम्युनिटी स्प्रेड है या लोकल स्प्रेड, तो फाइन लाइन तो है, इसके बारे में तो एक्सपर्ट ही बता पाएंगे। बट हाँ, कुछ केसेस में ऐसा भी है कि जिनका हमें सोर्स नहीं पता लग पा रहा है कुछ।
Remember, some 12% of positive COVID-19 cases are in Delhi. Let's get some updates from the ground. Migrant laborers are among those who are facing particular difficulties during the lockdown period. Now, in view of this, Maharashtra government has set up several shelter homes across the state to take care of their needs. An update from our correspondent Yogesh Kumar Sital.
Solving the issue of migrant workers is one of the major challenges that Maharashtra is facing. Most of the laborers are running out of money, running out of food, and that's the reason many shelter homes have been set up by the government. This is Sidco Exhibition Center, already a big place. This place has been set up for the purpose to accommodate migrant laborers, because in Bhiwandi many power looms have been closed, have been shut. In Panvel there are some industries that have been stopped, and that's the reason why the entire workers, why the entire laborers are there. They don't have any ways to go. They transportations are not working as of now. So there are many challenges that they are facing, and the government of Maharashtra is trying to mitigate the challenges, to sort out the challenges, and to provide as possible as they can. With camera person Naveen Paul, this is Yogesh Kumar reporting from Mumbai.
And while the migrant laborers and daily wage workers are facing hardships in the national capital owing to the lockdown, Delhi police is coming forward, providing food to them at multiple locations. In order to get some relief, the district DCPs are trying to reach out to as many such people as possible. In the Dwarka district, additional DCP RP Meena said that police teams are distributing food packets and water to poor people. Besides distribution of food, the police is also urging migrant workers to remain where they are and maintain social distancing.
जब से लॉकडाउन शुरू हुआ है तब से द्वारका जिला पुलिस लगातार इस तरह का जो खाना बांटने का काम कर रही है, और तकरीबन आज तक हमने 5 लाख लोगों के आसपास सबको हम खाना खिला चुके। करीबन 10,000 रोटियाँ गुरुद्वारे से दी गई है, जिनमें हर एक थाली में हम तकरीबन 5 रोटी और सब्जी उनको दे रहे हैं। और आसपास की जितनी भी जो लेबर थी जो यहाँ पे कंस्ट्रक्शन साइट पे है, उनको हम सब ने बुला के और यहाँ पे खाना बांटा।
Now, as part of our Mythbuster and Fact Check series, we bring you verified updates to prevent rumors and misinformation spreading across social media. Now, a media report has been circulated on social media claiming reduction in central government pensions. However, government has made it clear that there will be no reduction in employees' pensions by, as it is said, 30%, and terminated for those who are aged above 80 in the context of COVID-19. BIB Fact Check team says it is false and baseless. Do not believe such rumors. Now, India sent medical supply to many countries, including Kazakhstan, yesterday, strengthening its efforts to fight coronavirus pandemic. In order to help the world combat the virus, India has sent medical supplies, including hydroxychloroquine tablets, to several countries. Earlier this month, India announced that it will send hydroxychloroquine to 55 nations to fight the virus. And thanking Prime Minister Modi for sending the medical supplies to Kazakhstan to help the country fight coronavirus, Kazakhstan President Kassym-Jomart Tokayev said that India's gesture to help in such time is a mark of friendship and solidarity. Now, moving on to some international updates, let's now look at some data and graphical representation of the outbreak of COVID-19 in different countries. Remember, steep curve is when there is a sharp rise in the number of cases. Take a look. And next, we'll talk about some best practices that have emerged, some of the countries that have really done well against COVID-19. South Korea is what we're going to talk about. It is, in fact, garnering headlines across the world in the manner in which South Korea has been able to deal with this case. Let us understand this case study first. It was at one time after China an emerging epicenter. 10,661 cases appear in South Korea and 234 deaths. So if you look at the number of casualties as compared to many in the world, it is quite remarkable how they maintained that number. Understand the context even better. The first case around beginning of March in South Korea occurred around the same time as United States and UK. From there on till today, we'll see how the things have transformed. In South Korea, the increase in number has been per day. The increase of confirmed cases has been quite in control. Just 30 cases per day at an average has been reported for the past many weeks, whereas in US and UK, although they started around the same time in beginning of March, United States, over 20,000 cases per day are being reported. In UK, around 5,000 cases at an average are being reported. So you compare how South Korea has handled the challenge better as compared to many other developed countries like the UK and the US. Moving on to the next slide to understand how they did it. The key lies in early diagnosis, quarantine and treatment. South Korea did not wait for the disease to come to their country. They acted as soon as the numbers increased in the neighborhood in China. So early diagnosis, quarantine and treatment lies at the heart of it. Innovation was also very important. The world today is talking about how drive-through tests, like you buy a burger at a McDonald's center, you drive into the center, get tested and come out of the center and it's done. Some 500 such screening clinics with smaller workforce. So they started early. They didn't need a bigger medical force to handle the situation. A smaller workforce handled it. Some 500,000 people have been tested in South Korea. Per capita, like the overall population taken into consideration, this number is the highest in the world if you look at the per capita of the population. So it's remarkable the speed at which South Korea got its population tested. Screening, in fact, began 2 weeks before a single case was recorded in South Korea. So that proactive action is what really got South Korea this far. It also, remember, learned lessons from other viral infections in the last decade, SARS, MERS, which is Middle Eastern respiratory syndrome that occurred. Although the casualty in South Korea was not much, but they learned lessons what to do in such infection-related cases. Also, the advantage, it's a tech hub, really, South Korea, we know, electronic hub. The tech advantage, it already has an online work culture. People work from home. It does not have conventional offices like many part of the world. It didn't take much time for them to change into that sort of a work culture. Targeted quarantine is what they worked on. So one of the only countries in the world, in fact, that didn't really focus on large-scale or full-time lockdown. So targeted quarantine worked for South Korea. In fact, many of its schools and work offices are open. People are working while the world is grappling with the menace of coronavirus. So those were some of the ways in which South Korea dealt with the challenge of coronavirus, and the world can learn much from the way in which South Korea handled the challenge of coronavirus. Now we look at some more updates from across the world now, as relief aid, an aeroplane carrying some 14 tons of medical supplies from China arrived in Argentina to increase its testing capacity amid coronavirus pandemic. The airplane is the first of the expected 8 flights to bring medical supplies, including specialized face mask and face shields. The move comes as Argentine government has been seeking to ramp up testing before it lifts the quarantine restrictions. So far, Argentina has reported some 2,800 confirmed coronavirus cases, of which 132 have resulted in deaths. Moving on to some other updates as well. In Italy, 3,491 new coronavirus cases were registered in a day, which was nearly identical to the previous day increase in confirmed infections. Total death toll has climbed to 23,227. The number of confirmed cases has neared to 1,76,000. However, Italy is approaching the end of its 6th week nationwide lockdown, with people allowed out of their homes only for essential work. And France has reported 642 more COVID-19 deaths in the past 24 hours, but registered new falls in the total number of coronavirus patients in hospitals and intensive care. The new deaths brought the total toll in the country to 19,323. This was the 4th consecutive day there has been a fall in the number of patients in hospital as well as ICU. France has been in lockdown since March 17. However, President Emmanuel Macron announced that the lockdown could begin to be eased from next month, May 11th. And Spain registered a sharp drop in its daily death count from coronavirus on Sunday, with the number falling to 410 from the previous 565. The total number of fatalities in Spain has reached 20,453. Infections rose to over 1,95,000. However, Health Ministry said the fall in the number of deaths can be explained by lower registration of fatalities over the weekend. Spanish Prime Minister had announced that he will seek a 2-week extension of the state of emergency that is set to run out next week, but he also said the government will begin to allow children to leave their homes from April 27th. And Russia has identified over 6,000 new COVID-19 infections in 24 hours, setting another daily record with an increase of 27%. The total number of cases rose to 42,853 with 361 fatalities. Russian President Vladimir Putin said that the situation is completely under control, stressing that the country has everything from strong economy to medical resources and highly professional healthcare system to fight the pandemic. Meanwhile, Canada and United States have agreed to extend border restrictions for another 30 days to help control the spread of the virus. Washington and Ottawa agreed last month to clamp down on non-essential travel while allowing trade to continue. Canadian Prime Minister Justin Trudeau said the agreement is unchanged, while United States has been the worst affected country due to the COVID-19 outbreak, with the death toll of over 38,000. The total cases of infections in America at 7.32 lakhs. However, in Canada, 1,400 deaths and over 34,000 confirmed cases have been reported. Now, we've neared the conclusion of the program. Quarantined in her apartment for nearly 5 weeks, Parisian Agnes Goet has turned to watercolor palette to pass the time. A real estate manager by profession, Goet paints as a hobby, keeps journals of travels from different parts of the world. Now she draws inspiration from her life indoors. As we conclude, we leave you with Agnes's artwork. Be inspired. Take care. Namaskar.